Can you see me? Am I coming through? All right, great.
Hello, Governor. This is Kirk in Grand Rapids.
How you doing?
Great. How are you?
Uh, You know,
Yeah, 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 I
I'm
do.
good. I'm healthy. I'm determined to keep doing everything we can, but it's
Absolutely.
challenging. I'm not going to lie to you.
I bet. Well, thanks for doing this. We appreciate it. As you know, people are now starting to die because of this virus in our state. Are there any measures, other than what you've already done, that you're considering to do to help us flatten the curve here?
Yeah, so thank you for using the appropriate language about flattening the curve. I think that's got to be all of our goal. As we look to community spread in Michigan, we know that that's what's happening. We've had 3 people lose their lives, and there are a number of people that are fighting for their lives as we speak. And this virus continues to get spread, and that's why the aggressive actions that we've taken have been so important. But it also relies on every one of us doing our part. I know that this is an unsettling time, to put it lightly. I know that there are people out of work. I know that there are businesses that are shuttered. And yet, I also know that in the best interest of the health of our people and the health of our economy in the long run, we all have to take part in this. And that means observing the CDC recommendations of
Mhm.
staying 6 feet away from people, washing your hands frequently, coughing into the upper arm, not going out of the house unless you really need to. It's really important that every one of us takes this seriously and does our part. We've had a person as young as 5 test positive for coronavirus in
Wow.
Michigan. No one is immune from this, and that's why it's so important. I mean, no age group is immune, and that's why it's so important that every one of us does our part.
Absolutely. Let's talk about the schools for a second. Do you have any plans on extending the time that you want schools to be closed in our state?
At this point in time, I can't predict where we will be by April 5th. I can tell you this, that the numbers continue to rise at a precipitous pace. I can tell you that we are experiencing the worst outcomes in terms of there have been a number of people who've lost their lives at this juncture. I can also tell you that as we get closer to April 5th, we will have more information. We will make decisions based on the best science and what's in the best interest of our kids and our educators. And we will communicate that. At this point, it wouldn't be responsible for me to make a prediction about where we will be. I can tell you this, my team and I, and incredible healthcare workers and educators around the state and first responders are pitching in and working 24/7 to make sure we mitigate the harm that is done and the length of time that it has stalled our lives,
Right.
including the education of our kids.
As you know, the San Francisco area is shelter in place. New York City is considering it as well. I know you mentioned yesterday that that is something that isn't really on the table here yet, but do you have a set or a criteria in which you would do the same thing here if we reach those levels? You would trigger something like that?
Well, shelter in place means to stop and stay exactly where you are. We can't afford to have healthcare workers and first responders and the National Guard and our state police and our educators who are delivering meals right now to 750,000 kids
Hmm.
who would be going without meals, but for their work, to stop doing what they're doing. We have taken aggressive actions to mitigate congregation of people in the general public. We're asking that everyone observe those, and we're determined to enforce them. But the fact of the matter is, until at this juncture, we're not in a position where I'm making that kind of an order. I know there are conversations in other parts of the country,
Right.
and I understand there's even a conversation at the national level. From what I hear, all I can say is that right now in Michigan, we think that we are on the front edge of the aggressive steps that states have been taking, and we're going to continue to be making decisions based on expediency, making them aggressive, and always informed by the best science and what's in the best interest of the public health.
Any update for us on getting more testing equipment here in our state from the feds?
Well, so I have a call with the White House today,
Mm.
so I'm hopeful that we will get more concrete information. We have gotten, there apparently are more tests that are supposed to be on their way to Michigan. I'm hopeful that that is accurate. I also know that there are a lot of private labs that have been set up, and so while that is a great thing, it certainly is a challenge for getting all the information and being able to share it in real time. We're working through that. But there are a lot of different entities in the public sector and the private sector that are coming together to help us meet the need where the federal government hasn't been able to deliver.
And as of right now, there appears to be no positives in the Upper Peninsula. Do you think that's because is it a lack of testing availability there, or maybe it's just because it's simply more of a rural area in general?
Well, we know that areas where people have come to or from other places are where we have seen the initial instance of positive cases. And so the lack of international travel directly to the UP is perhaps contributing to that low number. The
Right.
lack of enough testing kits that we really need is perhaps a factor as well. I did read an article that a woman who had passed through Sault Ste. Marie had tested positive. She's a Canadian woman. So, as we've always known, it's a matter of time before COVID-19 comes to Michigan. I don't know if it will come to the Upper Peninsula. I'm hopeful that it doesn't, but we need to be prepared for the instance that it does.
And just a week or so ago, people thought this was all being blown out of proportion. People are finally getting the message and taking it seriously. What is the takeaway you want all Michiganders to hear from you today?
Take this seriously. There's not a generation of Michigander that is immune from this. We have seen a 5-year-old in our state test positive. 3 people have died from this virus. Every one of us needs to do our part. Even if you're a 25-year-old who is in great health, you can be carrying and transmitting COVID-19. The longer that takes for us to mitigate community spread, the harder it's going to be on our economy and the more lives we are going to lose. And that's the most important aspect of this. So everyone needs to do their part, washing your hands, observing the 6-foot radius, ensuring that you're not going out unnecessarily. I understand that there are people who have to still get to work and have to show up in person, but take all of these precautions and don't expose your loved ones and your family and your coworkers unnecessarily by not observing these guidelines.
Hey, Kurt, we have about 30 seconds.
Governor Whitmer, we know how busy you are, and we really appreciate you taking the time to talk with us today. Thank you so much.
Thank you. Be well.
You too.